Hello everyone. So today in this video we are going to talk about the cutaneous mycosis. So in the cutaneous mycosis we are going to talk about the different dermatophytes infection, and we will also talk about the pityriasis versicolor infection or pityriasis versicolor that is caused by the Malassezia furfur infection. Now first of all, let us talk about the cutaneous mycosis. The cutaneous mycosis is also known as the dermatophytes infection, and those dermatophyte infection is known as the tinea infection. So these are the tinea infection, and those type of tinea infection includes microsporium, trichophyton and epidermophyton. So the sites where the microsporium, trichophyton and the epidermophyton I have already discussed in the classification of the different mycosis. You can review that video. So this type of the cutaneous mycosis, the dermatophyte mycosis, in the KOH wet mount, if we do the KOH wet mount, we see the branching septate hyphae. So in the KOH wet mount and in the preparation with the blue fungal stain, we see the branching septate hyphae, and it is often associated with the pruritus. So you can also see in this picture is that in the KOH wet mount preparation with the blue fungal stains, there is we can see the branching septate hyphae. So this type of the mycosis, this type of the tinea infection, the name is different according to the different body place it affects. So the common lesions we see is that the annular ring like the plaque with center clearing is seen. This is like the common lesion we see in the all type of the dermatophyte infection. Now first of all, now let us discuss one by one each type of the tinea infection. So Tinea capitis. The tinea capitis, we call the tinea capitis when we see the dermatophyte infection on the head and scalp, and it is often associated with the lymphadenopathy, alopecia and scaling. So you can also see in this picture is that there is the lesion you can see in the head and scalp. So it is often associated with the lymphadenopathy, and you can see the alopecia and you can see the scaling in this figure. Now the Tinea corporis. The Tinea corporis, you can see it occurs usually on the torso, and it is acquired from the infected pet or farm animals. So you can also see in this picture, it is the lesion of the Tinea corporis. It is usually seen in the back side of the trunk or in the front of the chest. So now let us move toward the Tinea cruris. The Tinea cruris, you can see it in the inguinal area, and unlike the other tinea infection, there is often no central clearing is seen in the lesion of the Tinea cruris. Now the Tinea pedis. So this type of Tinea pedis, you can see the three variants. It is interdigital. You can also see in this picture between the digit you can see the lesion of the Tinea pedis, and mosaicism distribution. The mosaicism distribution at the side of the sole you can see, and the vesicular type of the Tinea pedis you can see in this picture. And lastly, the Tinea anguinum. The Tinea anguinum, you can see that it occurs usually on nail, and it is one of the most common cause of the fungal onychomycosis. Now let us discuss about the pityriasis versicolor, and this pityriasis versicolor is caused by the Malassezia species, and in the Malassezia species usually the Malassezia furfur, and it is the yeast-like fungi, and it is not the dermatophyte. Usually we say the Tinea versicolor, and usually it is pityriasis versicolor, but the name is Tinea, but it is not a dermatophyte. What happens is that you can see the deep pigmentation in the lesion. You can see also see the lesion of the pityriasis versicolor. There is the deep pigmentation of the color, deep pigmentation of the skin. Why there is deep pigmentation is that this Malassezia species degrades the lipid, and which produces the acid, and this acid inhibits the tyrosine, and inhibition of tyrosine will ultimately decrease the melanin synthesis, and there will be the hypopigmented patch. This hypopigmented patch is less pruritic than compared with the tinea infection. So this pityriasis versicolor is more common in the summer, and in the stain you can see the spaghetti and meatball like appearance, as you can see in this figure. And the treatment of this pityriasis versicolor is we usually give the selenium sulfide topical or oral antifungal medication we give. Now we have discussed the cutaneous mycosis, and we have also discussed the pityriasis versicolor. So in the cutaneous mycosis, once again I am going to summarize in a brief. In the cutaneous mycosis, in the stain you see branching septate hyphae, and you can see the different type of the tinea infection, like Tinea Corporis occurs in head and scalp, the Tinea Corporis occurs in the torso, the Tinea Corporis occurs in the inguinal area, the Tinea pedis has the three variants: interdigital, mosaicism distribution, and vesicular type. The Tinea angonium occurs in nail, and the pityriasis versicolor occurs in the whole body. It occurs as the hypopigmented area, and this much for the cutaneous mycosis. In the next video we will talk about the opportunistic fungal infection. Thank you.